My name is Kaylee Ivy, and this is my speech informing on the measles vaccine debate. In 2000, the United States declared measles eliminated, a major milestone for public health. But since then, things have changed. By 2019, there were over 1,200 reported measles cases, and this year, more than 1,000 cases have already been reported across 31 states, including 3 confirmed deaths, according to the Associated Press in June of 2025. But why is this happening? Well, a major factor is declining vaccination rates, especially among children. Today, I want to explain how this issue is shaped by different perspectives, including parents, healthcare providers, public health agencies, and policymakers. But first, we'll look at how these falling rates are affecting herd immunity. According to the CDC's 2023 MMWR, vaccination coverage among kindergartners dropped to 93% in the 2022-2023 school year. That is below the 95% needed for herd immunity, the point where enough people are protected that the disease can't spread as easily. The National Conference of State Legislatures warned in 2025 that continued declines could bring measles back as an endemic disease. That means that it could circulate in the population continuously, not just in isolated outbreaks. We've already seen outbreaks in places like Ohio and New York, and in both cases, clusters of unvaccinated individuals contributed to the spread. These local declines in coverage can lead to big public health risks. Now, let's talk about what's behind those numbers. One major factor is the decisions made by parents. Some parents are concerned about vaccine safety. A 2023 study in the journals Vaccines by Novilla and colleagues found that fears about a link between the measles vaccine and autism still exist. Confusion and misinformation also play a big role. Melissa Richard, writing for KFF Health News in 2024, reported that many parents struggle to sort through contradictory messages online. It's hard to make informed decisions when the internet is so full of mixed signals. Others may avoid vaccines due to cultural beliefs or past experiences. In some communities, there's a level of distrust of the healthcare system, especially when families have felt overlooked or misunderstood by healthcare providers. So, how are healthcare providers responding to these concerns? Well, according to the CDC, the measles vaccine is about 97% effective when both doses are given. Healthcare providers emphasize this along with the importance of herd immunity, not just for individual children, but for those who can't be vaccinated at all. But the doctors aren't just giving out facts, they're actually also learning better ways to communicate. Dr. Sean O'Leary told ABC News in December of 2023 that more providers are using a motivational interviewing model, a method that focuses on listening, building trust, and guiding parents toward informed decisions. This approach is less about persuasion and more about creating an open, respectful conversation. And for many families, that kind of trust makes a real difference. On a broader level, public health agencies are also working to address vaccine hesitancy. The CDC reported in 2023 that non medical exemptions have reached a record 3%. To respond, they've launched targeted campaigns and partnered with social media platforms to slow the spread of misinformation, as reported by KFF Health News. In areas with low vaccination rates, local health departments are holding community forums and creating multilingual materials to reach more people. These efforts are designed to make sure the messaging is both accurate and culturally relevant. Let's turn now to how state lawmakers are getting involved. Policymakers in different states have taken different approaches. In California and New York, for example, non medical exemptions were removed after large outbreaks. According to a May 2025 article by Lauren Gardner in Politico, those policy changes helped raise vaccination rates, but not every state is moving in that direction. A December 2023 report from ABC News highlighted that some states expanded exemptions, often citing concerns about individual rights in the wake of COVID-19 restrictions. Some states are also exploring other options, like linking school funding or insurance coverage to vaccination rates. These ideas are still being debated, but they show how the policy landscape is continuing to evolve. To wrap up, the return of measles in the US is connected to declining vaccination rates, and those rates are shaped by a range of perspectives, from concerned parents to healthcare providers trying to build trust to public health agencies adjusting their strategies and lawmakers responding with new policies. Looking at these different viewpoints helps us to understand the full picture. It also highlights the importance of continued communication, education, and collaboration when facing public health challenges. Thank you so much. This is my speaking outline.